Morning.
Oh, that's No, I can't go. No way. Denver's or Colorado. Nah.
Yeah, that's where my whole family's from.
So you're in the
I am. Yeah, but I just know what it is. Yeah, this is older. It's really just on 420, like they have all these helicopter shots of the whole, like from above, it's like, oh wow. Oh my goodness. Yeah, it's way better. Yeah, like I've met that. And your costume, and it's just, yeah. Oh wow. Yeah, it's like, but I feel like the whoa! Why do you always die? You have? So you're going to forget to do your
Okay, I need 9 more.
Hey, who didn't do it?
Yeah, thank you. Come on, let's get it on. I know, I made you guys promise to come if you didn't have a quiz, so let's see if there's 41 of you here.
This should be like a 10-point.
extra credit.
I
Like
think
2 points extra
Like
credit.
50 points of the 10.
Oh my god.
It should be. I've done that before when I really want you guys to show for a guest lecture and I didn't have a quiz. Not maybe 50, but
Like 500.
it's basically your whole grade. Okay, 5 more. I'm gonna start class. So you're either here or you're not, whether you're here or not.
Oh, that makes sense.
Wow, I can't believe you.
Okay, anybody else want to get in on attendance at the beginning?
Last call.
Last call. No, you have to do it.
It's extra credit, so.
I might think about that. I did hear, though, that your oral path exam got changed to Monday.
Yeah.
Just out of pure proctors, but whatever it takes. That was God's answer to my prayer. Or your prayer and my prayer, and a lot of prayers.
We heard you
Let's
got all
see,
the answers
42.
on the final.
Did you?
Yeah.
You mean an oral path? Did he tell you that story?
Yeah, he did.
When was he here?
He was here
A couple of weeks ago?
2 or 3 weeks ago.
Yeah.
On Friday.
Yeah. What did he tell you exactly?
You guys were a really good class, and then you worked really hard, and so for the final, you like gave her answers, or you like.
He didn't give us a final.
Oh.
He gave us a grade we had earned up to that point.
Can you convince Richard to that for us?
That's not
I don't want the
gonna
grade I have to that point now. I need the finals.
Yeah, he doesn't. I'm surprised he told you. He's always with us. Great class.
I thought you pay it forward and do that to us.
No, I like your test. I like your test.
It's fair.
Well, I can apply it.
Good. that makes me happy. And what really makes me happy is that you still remember my next grade for your
The pharmacology, not so much. That's like, I can't really apply it.
I like a corn lady.
Yeah, still doing that like role play, right?
Yeah, that's the summer though. We trying to reduce the stress at the end of the quarter. We were doing it during final week. And everybody was like,
Not showing up?
no, they showed up, but the stress level was off the chart. So, not healthy. So we decided it wasn't healthy. Yeah. We decided it was better in the summer. Okay, I'm going to start. Okay, too bad for the 3. Yay, you must have learned that in another class. That makes me so happy. Okay, we're going to start. Has it been really hot in here, or just had the door open? Can I close it now? Anybody opposed to that?
It was
Really stuffy. Oh, she said it was stinky.
There's a fan right here.
Okay. We'll go ahead and get started. I want you to finish the in-class assignment, the case study in class, so you don't have to take it with you.
I like that.
So I do too. So that will be really good. So we want to get going. I love this one. And think about your patients when you're thinking about this, but everybody else in your life as well. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear. Your patients love that. An honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. And that's really true with your patients. They seriously come to not only have their teeth taken care of, but to see all of you. And usually it works out that you get to see the same patient during your duration here as a student. Really fun. And then in private practice, you can see people for years and years. I was in one office 15 years, so watched the kids grow up and saw the same people. I still send Christmas cards to some of them, and they me from all years ago, but you become really close with them. And I notice people who are wandering around campus. I'm sure you get asked for directions. Do you guys get asked for directions? Okay, I was thinking, yeah, I must say, I know where to send you. But I always get asked for directions, but they so appreciate just people taking a little time to be kind and help them out. So then I have another one by Mother Teresa that I love. This is perfect for you guys. I know God will not give me anything I can't handle. I just wish He didn't trust me so much. Is that how you feel this quarter? Well, Mother Teresa agrees with you. Trusting me too much this quarter. Well, see, God, remember we talked about sometimes God cancels things that we think are absolutely not able to be changed or canceled. It's not canceled, but at least it's changed to Monday, and it's giving you more time. It's probably going to ruin your weekend, but it will give you more time to study. So I'm really thankful for that. But I know you still have a quiz tomorrow, right? So it didn't get really easy, but that will give you time. And But it's Mother's Day. Be sure and call your mom. Or, yeah, well, you study for Pat, but if you call and tell her how much you love her and thank you for everything she's done. Or if you have children, hopefully they do the same. Even 3-year-olds, 4-year-olds. So, okay, any prayer requests today? Yes.
On Sunday, somebody shot my cat with a BB gun and shattered his arm. And he had surgery on Tuesday. And yeah, he is in recovery, but it's just like a lot. It's going to be a 4-month recovery. And luckily, I got approved for a credit card. I literally don't know how. So it was $4,000. It was all on the credit card. And so I have to figure out how to pay that off in 6 months. And like, my mom's taking care of it, but she has a job, so it's just like a lot of people are coming together to try and.
Is the cat at
In
home?
Washington, yeah.
Oh,
So that just is like.
that's really rough.
Yeah.
I think everybody has probably had a really traumatic pet experience and can relate to that part. Maybe not the $4,000 part, but maybe you can. I've had a few really, so we are praying for Hannah and the cat and her mom taking care of the cat. That's really rough. And that person who shot the cat with the BB gun. We need to pray for them to be nice people. Okay.
So my brother is gonna go through ACL repair surgery today. So I just want to pray that everything goes well. And I hear the recovery is just really rough. He's not looking forward to 6 months of crutches. So.
6 months of crutches?
Something like, or 3 months. I can't remember. He said it's a big one, and he's gonna be 2 weeks bedridden.
Oh.
So I'm like, I'm sorry, bro.
Yeah, I'm sorry too. Okay, that's a good prayer request. Any others? Yes.
Sometimes brother.
Yes. And, okay.
That's more personal. I think personal for me. I just, because of all the studying, I feel like I have been like slacking off on my devotion time. I feel like I don't have time at all to read God. I say like read God's word. I say more or less, and I just wanna figure out. I guess I don't find it important right now. I'm not putting importance in that. I really wanna like be. I don't know. What do they call that? Connect or like, yeah, or make time for it.
Maybe just pockets of time here and there throughout the day, just a connection. It can be short. God can understand that, I believe, during really hard times. But if you can I find that life is a lot better if you just send up prayers here and there, even if you're walking and you just have a moment. You're walking to the dorm or you're walking to a class or you walk outside and it's beautiful. If you like dreary days and you thank God for it. If you like sunshine and it comes back, and just times I do so much better if I try to connect all throughout the day, and sometimes that time in the morning might be shorter than you wish. But I pray that you could just kind of get those little pockets of time to connect. So I'll pray for that for you and for everyone, because everyone needs that. That's what happens when it gets really busy. The things that aren't absolutely required of you get pushed aside, and so that's hard. Okay, it seems like I saw another hand. Yes.
Same with her, but you can find the time to exercise too. I didn't exercise for like more than like above a month.
Exercise, sleep. Hopefully you're drinking water, because there's water at the end of the hall. You walk by and Okay, anything else? Lots of things, I'm sure, but okay. Okay, let's go ahead and pray. Loving Heavenly Father, you've heard all the requests that were spoken, and you hear all the requests that are unspoken, and you even recognize needs that maybe haven't even been lifted up to you, and you are there for every person in this class, and you recognize big needs and little needs, and you're involved in every one of them. And so we have a variety of requests today. We pray for Hannah's cat, for recovery, for the ramifications of something like this happening, and the cost factor, and family having to step in, just be with the situation and help her to know what's the next step. And just pray for Maddie's brother as he goes into surgery today. Please be with the surgeons, be with the anesthesiologists, and be with his recovery, and help it to be quicker than they anticipate, or give him a good support system as he goes through that. We lift up Sunshine's family and whatever they're going through right now, and I just pray that you are present in everybody's lives and give them strength during this time. You hear the plea for more time with you, more time to sleep, more time to exercise. It's a difficult quarter to find time. I pray that you help them to prioritize the best possible, and to just maybe fit in little pieces here and there of everything that they need to be doing. And especially our connection with you. We know that you see what they're going through, and that you look down, you understand, but at the same time we need that connection more than ever when we're going through hard times. So we just really pray you pour out the Holy Spirit on each one of the students, and give them wisdom, give them strength, give them rest, and just guide us through this day. Be with us as we learn how to treat some more patients that we may see in our future, and to be compassionate and to touch them by being your hands, your feet, your words. Thank you for hearing our prayer. We call in your name. Amen. Okay. We got through that. So a lot of this stuff today you've heard about, so it won't be quite as taxing, I hope, to your brain, but we'll try to hit some of the big things, and I'm going to kind of clip through it so we seriously have enough time. I want you to really work on this case study. I'm going to grade it a little more seriously this time, so that it would be similar to how I would grade. I'm going to put it a case study, not maybe quite as complex, but in your sectional next week like I did last time. So I just want you to be thinking about what's missing on this, what do I need to know. So it's really good to do it in a group, and you can learn from each other, and I would actually review your submission for your exam and review my notes that I respond back to you, and I'll try to be quicker about doing that. It takes me quite a bit of time. So I will try to get that back to you so you can kind of see what are we missing. But look for those yes answers and say, do I need more information? And if you think you do. Also, I kind of give you help by giving you the patient's answers to a degree. Afterwards, I didn't give them all to you today, but a lot of them. So if you didn't think of that question, you should go back and insert it and write it. Okay, so same with the exam. I'm going to give you some responses the patient gave you. So say the response says his INR is 3.7, then you want to be sure to go back and write, what is your INR? Do you know what your last INR was? And when was it? If I say its last INR was May 1, and it was 3.7, I would reflect on that and go, what should I have asked? So I kind of give you a little tip in a way, but there's some questions I won't answer for you either. But be sure, and if you see they go to their physician and that's all they said, ask some more questions. You always want the name and number of the physician if you ever need to call them, and you want to know when they were last there and for what reason. So it's just good to look at all that. Just try to think of everything and try to think of the modifications that you would make depending on that. Those answers too. Okay. So we're going to talk mostly about pregnant women, but also lactating women, women with osteoporosis. Men have it too, but women are more likely to have it. Hormone replacement therapy, and then we're going to just touch in on gastrointestinal disorders just to fit it all in before the end of the quarter. Not that they can have to do with each other. Actually, many pregnancy symptoms include them. Okay, so if someone says they're pregnant, probably the number one thing we need to know is where in the pregnancy are you? What week are you? Probably better to ask what week than what month, because the way the 40 weeks lays out, people think they're 4 months when they're at 16 weeks, but that's not quite even halfway through, and they count 2 weeks before you're even pregnant as part of the 40 weeks. It's kind of a weird cycle they do. So the best thing to do is find out what week they are. So first trimester is through 13 weeks. Middle trimester doesn't start till the 14th week. So you kind of want to know what we're really looking for pregnant patients is we would prefer to treat them in their middle trimester. So that is 14 through up to 27 weeks. So that's our favorite time because the patient is the healthiest, the baby is formed. It's amazing what's already formed by 14 weeks. Almost everything is formed and now it's just growing, and the tooth buds are between 4 and 5 weeks. 4 and 5 weeks of conception. It's amazing. Palate, lips, cleft. Their lips are like 6 weeks. Clefts are between 8 and 12 weeks. So cleft palates are there in 8 or 9 weeks. The heart is beating by 8 weeks. So the heart is formed. All those little chambers are formed. They're like, the baby's like this big, and the heart is formed. And I've been seeing it again because my daughter is 16 weeks pregnant again. And so you get to see this just amazing. I mean, the baby's about this big now. And, but everything. You can even see the profile, the actual profile. And it's just phenomenal what's there. So a heart defect happens between 8 and 9 weeks. Everything in that first trimester is forming. We really want to avoid, especially any what they call teratogenetic medications. Any kind of medication that we would add, we don't want to really give them anything if we can at all help it. Now the difference is we're elective dental treatment, so we usually can opt out. But if somebody has an infection or an abscess or whatever it may be, the other aspect is that's much worse for the patient to have an infection and have that in their systemic bloodstream going through the baby and utero than not having. So then we have to think differently. Sometimes we need to take in one single PA during the first trimester. Sometimes, they may need a cartridge of anesthetic so we can treat, extract an infected tooth. So we have to remember that, but mostly we're looking at the middle trimester. So if you can remember that, that's best case scenario. Not saying that we can never do a simple prophy in one of the other times. We're definitely not going to take x-rays if we can help it during first trimester or give any kind of additional medication. Also, it affects us if they're having nausea and morning sickness, especially if they're vomiting frequently. We've talked about perimyolysis. So have we talked about that word? Okay, I'm thinking seniors. You're going to hear me talk about it the rest of the time because then we're going to talk about eating disorders in the fall with special needs patients. And so I'll show you some pictures, but if somebody throws up every day or twice a day or 3 times a day, like some pregnant women can, really affects their teeth, the acid flowing over their teeth. So that's important. So the thing is, it's a normal condition. It's not that it's not normal, but a lot of things do change that can even affect us. So their blood volume increases 40 to 50%. That's a huge amount of increase. But at the same time, their red blood count only increases 15 to 20%. Not sure why that is exactly why it is, but that's why. Now you know about anemia. That's why pregnant women take additional iron, is to prevent anemia. So prenatal vitamins have a lot of iron in them for that discrepancy right there. Very frequent that somebody will have a heart murmur during pregnancy. So that's always scary if somebody checks heart murmur on their health history later, and they may have never been told that, oh, by the way, that was a functional heart murmur and it went away. You no longer have that. Usually that goes away after pregnancy because the blood volume decreases. So just something to remember. Let's see. So pulmonary, they have pressure, so increased breathing, so they may have shortness of breath. It's not necessarily cardiac related or functional capacity from walking up the stairs, but their immune system, they have an exaggerated inflammatory response because of the pregnancy hormone. So when we talk about in pregnancy gingivitis, there's a reason for that. And it also, they're more likely to get infections. So in something that increases the output of the heart because of that blood volume increase goes up, and they're more likely to get something called preeclampsia. Do you know what that is? Heard of preeclampsia?
Yeah.
High blood pressure during pregnancy. It can be almost fatal for the mother and for the baby. It's very, very serious. So that's one more thing you can detect when you're taking their vitals, is they may not have been in, and it can rise suddenly, and you may be able to detect that and refer them to their physician for that. My niece had to be hospitalized for several weeks before the baby was due just because of preeclampsia. So they definitely can have increased constipation and emptying, increased gag reflex. So if you're working on them, they could be really sensitive. And you've seen patients who can barely do press down their tongue to check the soft palate. This could increase quite a bit. Because of the increase of the pregnancy hormone, the BHCG hormone, that's why they can get increased or nausea and vomiting. Not everybody gets it, so I don't understand that. But okay, and of course everyone knows that a pregnant woman needs to go to the bathroom more often, so be sure and give them that option if they need it. The gestational diabetes is not a huge percentage, but 2 to 6%. With gestational diabetes, they're more likely to get type 2 diabetes later. We talked about that when we talked about diabetes. They also are at risk for large birth weight babies. And anybody with diabetes is at risk for that. So they really watch. My daughter has type 1 diabetes. She has to go in every 2 weeks instead of once a month to a high risk. It's considered high risk pregnancy when they have diabetes, because the insulin is really unpredictable. The insulin levels, or the blood glucose levels, I should say, are vary greatly during pregnancy. So it's it's actually somewhat dangerous and difficult, yes.
So would you treat them like in semi-supine or supine?
Okay, good question. Can we come up to that and answer your question in a little while?
Yeah.
It depends on where they are in their pregnancy. So if they're earlier, you're fine supine. But later, we're going to do semi-supine and even some other modifications. So I'll show you some good pictures, okay? Good question. Okay, so has anybody heard the myth, you lose one tooth for every child you have? I wouldn't have very many teeth left if that were the case, unless I count my wisdom teeth. So I guess that would be 1 for 1. But no effect on dental caries. So it's not like you're at increased risk for cavities during pregnancy. However, if they don't have good oral hygiene, they are at an increased risk for pregnancy gingivitis because of that inflammatory response. So this is a really good time to educate your patient because they're motivated. They're carrying a baby. Sometimes that changes a woman's whole attitude. They'll stop taking drugs. They'll, they'll quit smoking. They'll quit drinking. Not everybody, but sometimes. I sat by a lady and a young girl with a baby in an airplane once, and she told me her whole story about having a heroin addiction, and when she got pregnant, it just changed everything, and she went into rehab, changed her life because she was responsible for another human being. And so she was still living in a care facility where they helped her, but it was very, very touching. So you have the capacity to really educate and motivate people during this time. Have you guys in oral path talked about pyogenic granuloma? Or okay, good. So not true. The tooth composition is not changed. There's a picture of pregnancy gingivitis. But again, if they have good oral hygiene, they should be fine. But if they don't have good oral hygiene, they can definitely have a more exaggerated response, and it can carry after pregnancy too. So it's something that really is so helpful if you really emphasize their oral hygiene care. There's your pyogenic granuloma. Does she even call it that? Because I've been told that's okay. Epulis gravidarum. Does she also call it that? Do you have to memorize that and spell it? No. Oh, you can call it pregnancy.
We called it pyogenic granuloma pregnancy.
It was also granuloma gravidarum.
Okay, yeah, I looked up all the terms again. Because, and the reason, and maybe she told us, pyogenic granuloma can also occur on your skin, on hands. Did she talk about that? Not just in your mouth. So I add a little note under that slide. I just found it interesting. I never knew you could get it, and there was pictures of people who had gotten it on their fingers, and you can actually have it removed, but it may come back while you're pregnant unless they really remove the whole thing. So it might be something. If I saw one here, I'd call Dr. Richards down to just look at it and see if we should do anything. But most likely it just needs really good oral hygiene again. There's a picture of perimyolysis. So that's literally removal of the enamel by the acid regurgitation from throwing up, vomiting. That also can happen from GERD, which we're going to talk about today if you have severe GERD, acid reflux. So it's severe. To remove enamel is severe. Has anybody had someone who has enamel removed by sucking lemons? Has anybody seen that yet? It's this severe or more, except for it's on the anterior teeth on the front side. Oh, we had one just the other day. It must have been a senior. Severe acid removal of enamel, and usually they don't find out until they have a lot of loss. But I've even found it sometimes on patients and asked them if they suck lemons, and they did, and they didn't know that it was bad for their teeth. So some people just really like that tart, and if they live somewhere where they grow lemons or something. So be sure and educate them. I want to just throw that out because it is a severe reaction, and you do not get, your enamel does not grow back. So you don't want them to continue doing it. A lot of people, of course, have morning sickness. It usually ends at the end of the first trimester, but not always. Some people have it their whole pregnancy. But just, we want to remember, and you may have been taught this in another class, but you don't want them brushing within 30 minutes of vomiting. All the acid on the teeth, they can rinse with water or a sodium bicarbonate rinse, like putting baking soda in it. But brushing actually takes that acid and it etches out the teeth worse. So it should be a 30-minute wait time. And people do not know that. Obviously, see, we haven't taught you that yet. But that's going to be the same when we talk about bulimia. Same thing. They can rinse with anything that's, really basic, like baking soda, but should not brush. Yes.
What if you rinse really well?
Yeah.
And then
I would still wait. Acid isn't completely removed by water, but or be brushing all the time in between to have the plaque off, and then. But it's research has shown that it actually removes tooth surface by brushing right afterwards, and that's your tendency. Yes.
how long should you wait to brush after like you throw up and you rinse out your mouth with like sodium bicarbonate?
Yeah, about 30 minutes.
30 minutes?
Yeah. So not too long, but long enough that, it's hard to do if you want to get rid of that taste. So really important, though. That will be a board's question if you have a pregnancy patient or a bulimia patient on your boards. I'm almost guaranteed that would come up. Okay, so treatment during that, of course, I'm just going to read it because it's the best way of putting it. Prevention, diagnosis, and treatment of oral diseases included needed dental radiographs and use of local anesthetic are highly beneficial and can be undertaken during pregnancy with no additional fetal or maternal risk when compared to the risk of not providing care. And again, we're talking about risk versus benefit. And so this is mostly talking about first trimester, possibly last trimester, especially first trimester. But if you need one PA during first trimester because you have an abscess, absolutely put on the lead apron, put on thyroid collar, whatever you will need to do, but get that one x-ray so you can proceed with treatment, decide what to do, get rid of the infection, okay? We don't do that as hygienists, but the dentist we're working for, what if you see an abscess above a tooth, or somebody comes in, I want you to just know that risk versus benefit. That's always how we look at things. Okay, we've already talked about that. Okay, this is interesting. Pregnancy does not change our recommendations for what kind of antibiotic we give for prophylactic antibiotics if they had a high-risk cardiac. What are our number one high-risk cardiacs that we're going to pre-med for? I want to make sure you guys have them. Artificial valve and infective endocarditis. I promise you'll see that over and over again. The seniors just have something on that, and some of them, okay, I want to say this again too. Remember, mitral valve or prolapsed mitral valve versus prosthetic mitral valve. Which ones need antibiotic? My left hand or my right? Okay, one of them got confused. They thought it was prolapsed. And so they said, oh no, they don't need antibodies. Be sure and look at that. Just make sure. Prolapsed mitral valve does not. Prosthetic mitral valve, any kind of replacement does. So you guys have it. So if somebody comes in, there you go again with risk versus benefit. We are going to give them their dosage, whatever they can take, whether it's amoxicillin or clindamycin, whatever they're safe to take. But the biggie is tetracycline. You obviously learned that. Have you ever seen anybody with this kind of stain? It doesn't happen much anymore. So in your generation, everybody knows not to give pregnant women tetracycline. But even my sister-in-law, who's 5 years younger than me, she has severe staining, probably this bad. She finally had veneers done in all her anterior teeth from her mom having tetracycline. So it's not that long ago. She's even younger than me. So, but that's severe. That's definitely a terrible. Tooth is fine. Nothing wrong with the structure of the tooth, but the coloring is definitely not acceptable, or for aesthetic reasons. Okay, here's our supine hypotensive pregnancy syndrome. So I want you to look up right here, the aorta and the vena cava. See how it's open here and how it's completely flattened here? So if they're laying flat on their back, completely supine, that's what their aorta and vena cava are going to look like. Okay, not good for the baby. There's not oxygen getting through to the baby. The mom eventually is going to have decreased blood flow to her heart too, but also to the baby. So they get short of breath, have increased heart rate, and eventually they will faint. So the easy fix is to get that right hip up and put a pillow underneath it. Turn that patient to the left. They're leaning on the left, and they should be fine with the semi-supine. They can also lift that right leg. And that's easy to do when you're laying in a chair. But that's very important to know. This is really in the 3rd trimester. So most likely shouldn't have a problem. This came from your lovely Wilkins textbook. But this also is something that for sure would be a board's question if you had a pregnancy issue or a pregnancy case study. So right hip is the right side to put the pillow. Maybe that will help. And so lean over to the left side and it opens up the flow. Okay, now we just talked about, well, let me read this too. This is the terminology from the American Academy of Pediatrics and Obstetricians. Diagnostic radiologic procedures should not be performed during pregnancy unless the information to be obtained from them is necessary for the care of the patient and cannot be obtained by other means. Okay, so the recommendation is let's not do x-rays unless needed. So let's move to that next section. Let's say your patient is in their 1st trimester and they have an abscess, you just saw it, and they're freaking out about their baby having one x-ray taken to see this, and can't you just treat the tooth without an x-ray? But the dentist is not diagnostic, absolutely needs an x-ray. This is what you're going to tell them, okay? Because this is scientifically been determined that 2 dental films, so that's even 2 with a lead apron, has 700 times less radiation than 1 day of average exposure out in our atmospheric conditions. So, risk for a fetal defect is 9 in 1 billion. So we're talking 1 radiograph, 1 PA, 1 or 2 if we had to. We're never going to do an FMX. We're not going to do a pan. Unlikely, maybe a pan if they were severe because there's less radiation than an FMX, but most likely you're going to do 1 or 2 PAs. So you also need this information to calm the fears of your patient in case it needed to be done. So lead apron, absolutely. Thyroid collar, if they wanted to sit on one, put one on the back, put one on the front, put one over, that's fine. But with our high-speed film, our rectangular collimation, digital imaging, you should be fine. Okay, we're going to move to pregnancy categories. This is in your textbook, and this has been accepted for a long, long time, but they now have taken this away. And if you look in LexiComp, it's not there anymore. However, I want you to understand it so you understand what it has been. It may not even be eliminated in your boards because they're a few years behind, and the change was in 2017. So I just kind of want you to understand the risk stratification. Has Dr. H talked about this?
Yes.
Okay, and he's told you about the new, or just this?
Just that.
Okay. So I'm going to show you both because it's still being taught. It's still in your textbooks, and you might see it elsewhere. So you just want to know, since you've already been taught it, you understand the difference between pregnancy category A and X. B is where lidocaine would be with epinephrine. Okay, so it's down a little ways. We don't want to do it in first trimester if we don't have to. Again, risk versus benefit, so we might use B. B is most likely not going to hurt the baby, especially if you use one cartridge, okay? So you understand that. So really you need to know A, B, C, D, and X. X, it's just, forget it, not worth it. Okay, so it's actually changed in 2015. Why is it being removed? It felt like it made it too black and white and made it sound safe if it wasn't for somebody, or higher risk for different people. How many medications are they taking? Because you're looking at one in this category. What if they're taking 4? And they were saying that it used to be most pregnant women were maybe taking 1 or less. Now many pregnant women are taking multiple drugs going into the pregnancy. They may have asthma, they may have diabetes, they may have multiple different things, antidepressants, whatever it may be, that it's not safe to take them off of during pregnancy, but it does have an effect on the baby. So they didn't want to keep it in the categories because of that mix. And the doctor needs to look at the patient as a whole and independently. Not just say, oh, well, that one's a category B, and that one's a category B, and that one's a category A, and that one's category C. But they weren't looking at them all 4 together. So it made for too much allowing of that. So I don't think I know they took it out of lexicon. It used to show pregnancy categories. So we're just going to look at that. I just talked about that. So, and yes, woman's body changes throughout pregnancy. I know that for my daughter's second half of pregnancy with type 1 diabetes got a lot harder to manage and control her levels. And simply what your body does, the hormonal changes do a lot to your body. Okay, I don't know, that's a terrible picture, but that just talks about the new labeling is just pregnancy, lactation, and then females and males have reproductive potential. So some medications can affect male reproduction as well. Okay, also you want to think about if, at least the women in this classroom, if you're ever pregnant while you're working, you want to really be aware. Some people allow you not to take x-rays at all during that time. You're probably pretty safe as long as everything is set up where you have a barrier, but if they allow it, it should definitely be better just not to have to take x-rays during that time. And especially depending on the model of x-ray equipment they have there. So definitely think about that. Also, proper scavenging. If they do nitrous, you do not want chronic inhalation of nitrous if the office is using it and it's not being scavenged out properly. You know how we use the suction, and there should be no excess getting out. And you should never, it's not a good idea for you to deliver nitrous while you're pregnant as well. So just remember that somebody else can do it for the 9 months you're pregnant. They can see those patients if your office does nitrous anyway. So I definitely had quite a few people, I don't know, maybe only 4 or 5 that I routinely gave nitrous, but they were all the people who came in every 2 to 3 months too, the most frequent recalls. Okay, let's wake everybody up. We'll go to the next. See if you can remember that. What do you think about waiting for break until you break up into your teens, and then just like taking bathroom breaks, and then the faster you get it done,
Yeah.
you're out. Is that good? AJ says for sure yes. Anybody else opposed? Okay, I'll try to be quick. Okay. This should be an easy one. Hopefully. Okay, we're missing a few. Okay, so remember, right hip is the one that you want to get that pillow. Right is the right side. Put the pillow.
Why can't you do the other one?
I know, I was looking at that too, going, that's pretty much in the middle, but I don't know the pathophysio. I agree with you that it was questionable to me too, but I need to ask the cardiologist that. It must be shifted just a little bit, right or left. The vena cava must be more towards the right side, and so it's a better shift. That's only, yeah, I don't know the exact location of that. Okay. Okay, let's just quick get through the rest. Okay, the main thing with pregnancy lactation is medications as well. And they actually have a location in Lexicomp where it talks about lactating mothers. And usually what's the best idea is to have the baby nurse then take your medication. Because then you have 3 hours or so to have it go through your system and not be so heavily in your mouth. But it has, when that time comes or you're helping somebody, look it up in Lexicomp. Some medications, again, it's not as serious for a lactating mother as a pregnant mother because it's not going directly, but it definitely, some of them are still concerning. This, I teach this and I tell my daughters this, but this is something that I've decided is absolutely, I don't know anybody who doesn't do this. Karyogenic bacteria and periodontal disease bacteria can be passed from mother to infant. Avoid saliva sharing behaviors. That means you can't kiss your baby on the lips. Who's not going to kiss their baby on the lips? Or share a spoon. You're going to feel it to see if it's too hot. Then it goes in there. I've given up. I don't say anything anymore. I just go, okay, they already have your karyogenic bacteria, your whatever you have, they have. But I do want you to know that this is true, and it is. And if you have that much willpower, it would be best for your baby not to have saliva sharing. I love that. Saliva sharing behaviors. So, but that means even testing the spoon for temperature.
How long, to what age?
Yeah, that's, I imagine it's pretty much forever, so that's something to think about in all kinds of ways.
It happens to children as well?
Oh, I mean, I'm just saying, what is your question? My daughters kiss their babies on the lip and use the same spoon. That's what I'm saying.
Oh, okay. No, I'm asking to what age?
Yeah, I'm not sure. I don't know. I would think forever because it's just a reminder that bacteria does carry from one person to another.
So as adults, you can do the same?
No, I would imagine it's the same. So plan on sharing whatever your person you're kissing.
But maybe it's more because
Yeah.
has a less immune system.
Yeah, it probably does. I would need to research that more. The baby has none of that yet. They have some genetic factors, but they don't have any of that yet. So I'm sure the immune system does get better. That's a good question. Who would we ask? Who's the specialist in? What? Yeah, let's ask them. Because I'm not sure, like if the risk decreases at a certain age where we have more immunities. Because you do gain immunities as time goes on. So that's a good question. Okay, I don't know if you were you taught this in, since you've been talking about pregnancy in farm, that both birth control and hormone replacement can sometimes cause hypertension. That is one of the side effects, especially birth control pills. Sometimes can cause your blood pressure to increase. And so it's just like a differential diagnosis. It's something to think about if all of a sudden you're on birth control pills and your heart rate or your blood pressure goes up. It'd be something I would ask about. Again, I think you've already talked about this. Now I'm not sure with the seniors, but oral contraceptives, if you're taking antibiotic therapy, it can cancel it out. So definitely, we did talk about that. I remember. Okay, osteoporosis. You guys all know what that is. What is the medication that you've learned about in MedComp last quarter that is often given to patients with osteoporosis? This is the number one reason that medication was given, and it's had severe side effects. What is it?
Calcitriol.
What?
Vitamin D.
Bisphosphonates. Bisphosphonates are the number one reason they're given is for severe osteoporosis or even moderate to severe. So most often if your patient's on a bisphosphonate, it's for osteoporosis. Think bone. So the main other things would be cancer, like my dad. Anybody with cancers that affect the bones, they're often on a bisphosphonate. But osteoporosis is number one reason. Okay, so usually if your patient checks that, you look down farther, they're going to say they have osteoporosis. Higher incidence in thin white or Asian women, especially who smoke. Of course, lack of estrogen once you hit menopause increases that risk, or removal of ovaries earlier. Also, anybody who has to take corticosteroids for a long period of time could make osteoporosis set in quicker. Calcium, my sister-in-law's an OBGYN. She said she gives her children calcium. She started them at a young age. She says you actually need it starting at a young age, so you should all be taking calcium as well. Weight-bearing exercise, what you're not being able to do right now because you're too busy, but get back to it afterwards. Estrogen replacement therapy. So once people go into menopause, if they take estrogen on top of their age, just if they take it, it's somewhat helpful. Treatment with bisphosphonates. Don't forget that. Okay. Next, I'm keeping you awake. Trying. I'm not saying I'm doing very well. That's what the coffee was supposed to be.
Oh.
I'm pretty sure this came out of a review board book, this question. Most of these do. Okay, cool. Got that one. Okay. I think we're almost Okay, let's quickly go over this. Regina Bergen, a 28-year-old patient, presents for an emergency appointment as a result of pain associated with tooth number 29. Patient is 8 months pregnant and in good health. Oral examination reveals a large carious lesion on the occlusal surface of number 29. Restorative treatment is planned. Her vitals are pulse 80, respiration 18, and blood pressure 110/60. What would you highlight in that?
Her 8 months pregnant.
Okay, 8 months pregnant.
29 occlusal.
29 occlusal. I heard blood pressure, yeah.
Large lesion.
Large carious lesion.
Yeah, beats per minute.
What is that?
80 beats per minute.
80 beats per minute. Pain. One other thing that is kind of, it's not what you would look for maybe, but it's helps. Good health. That's what I'm looking for. She's in good health.
Isn't her blood pressure a little under?
No.
It is, but it depends on what's normal for that patient. Mine was about 90/60 when I was pregnant.
Dang.
Almost all my pregnant 95, 60. Some people just run lower. It benefits me in my older age. It's risen a little, but so it's not that abnormal. Unless usually their blood pressure is 120/80. What did you say, Daniel?
No, I just it's recommended to check it every day.
Yeah, I'm not sure that's what you said. AJ thinks it's funnier than that. No, it's not that funny. Okay, AJ, let's hear it. We all need a good laugh.
I did say it. I did say that. I did say that.
Anyways.
I'm waiting. Can't remember,
I
can
can't.
you?
It's
I'm
not
sure.
funny.
Just amnesia set in. Okay, yes.
If you have low blood pressure normally when you get pregnant, will I get even lower?
I'm not sure. It can go higher because you can have, but it seemed like mine went a little lower. I'm not sure on the exact. Yeah, is it?
I had a doctor who said one of them.
Are you okay?
He's cracking up.
Yeah, I'm having this spasm lately.
In your leg?
Yeah. Right in my hamstring.
Sorry.
Okay now.
Wasn't sure.
Yeah, okay. Thanks for caring.
Are you sure?
Yeah.
Okay. Are they like Charlie horses?
Yeah, I need to get more water.
That's really painful.
I know.
I'm just glad you're not having a seizure.
No.
That's not what I was first. I was like,
Yeah.
No, probably
Thanks for
throwing
catching
tonic face.
No.
Okay, I'm glad you're okay.
Yeah.
Okay, I mean kind of, but yeah. Okay. Which local anesthetic agent is considered safe for her? We haven't really talked about this that much, but a little.
Pollockine.
Pollockine could be, but she's in a lot of pain. What if we can't get her now and we have to give her a lot more? Actually, a lot of pain with Effie is okay. Pregnancy B category, old category. And if we're only going to use one cartridge for a good mental block, we're probably going to be fine. You only need a half a cartridge for a mental incisive. So you should be fine, especially if it depends on the situation, but it should be fine. Why would an NSAID be contraindicated for treatment of postoperative pain? Okay, bleeding is definitely an issue, but actually you're going to look in your textbook for this one, but it's interesting that NSAIDs actually can postpone what they call parturition, which is giving birth, and it can make the heart thing that closes right before you have baby. I'm blanking. You're going to look it up.
Ductus arteriosus.
Yeah, ductus arteriosus closes right before you have a baby, but it shouldn't close too early, and it can make it do that. So really, you don't want to have NSAIDs or aspirins throughout the pregnancy. Earlier in the pregnancy, it can affect the baby attachment in the uterus. So it's just a big no. NSAIDs and aspirin during pregnancy. Tylenol is recommended. Acetaminophen. Okay, can radiographs, we've already talked about that enough. Okay, quick, we're gonna do, I want you to do this one, so. Research, I bet you guys can't wait. Okay, see if you get this one. Daniel.
You just had
We just had a test on it.
You did?
Yes.
And farm. That's what I'm
Really?
saying. That's what I just said.
Oh, cool. Okay, quick. 41. I haven't got 41 yet. That means everybody's not here.
Reflex.
I hope you got it right on farm.
I wish you asked this.
What?
I wish you had asked this.
Oh, he didn't. It was different the way it was worded.
He did ask this.
It's just the same topic.
Oh, okay. Oh, 41. There we go.
That's not it.
Why are you blaming him?
That's not it. That's the upper esophageal. Oh, wait, I read it wrong.
Okay, everybody okay with that answer? It's in your textbook as well. Okay.
I was thinking
Okay. Okay, a few more slides and I'm going to get you going on that. Okay, the gastrointestinal disorders that you may see are GERD, peptic ulcer, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, and Crohn's disease. You've probably heard of all of them. I'm going to let you look up a couple just to kind of clarify that for you. Okay, so basically, the sphincter isn't closing enough, so the acid from your stomach comes up the esophagus, and it just really irritates and burns the inside lining of the esophagus. 10 to 15% of adults, so you're likely to see this. You're likely to see people on medications for this. See if there's anything. GERD can literally mimic a heart attack.
left arm.
Yes. Not so much the left arm, but the intense pain in the chest. And it's really good to know that. Not that you want to, everybody should always go to the ER if they're having chest pain. But I have heard of, when was it? One of the students, their husband, was down there when they were taking the National Board Review class. And her husband was down, so afterwards they could go, it was in Orange County, and she had to leave because he really went to the ER because he had so much pain in his chest, and it ended up being from acid reflux, severe. It is a real, it can be, really can mimic that. So I don't want you to think, it's just acid reflux. So always go in if you're having severe chest pain. Remember, everybody can have different types of symptoms. So you don't always have the left arm. You don't always have jaw pain. Okay, sorry. Just sounded. Poor thing. Couldn't help. So, okay. Acid erosion, we already talked about perimyolysis. Think that it's especially, this will be a question come fall, but it's always on the maxillary lingual of the incisors, because think about it, if you have reflux or you throw up, it goes up over your tongue so that acid washes the inside, the palate, especially the anteriors. So that is very typical of either throwing up or acid reflux. Okay? Smooth, shiny, remove surface. Okay, semi-supine position, absolute modification you would have for acid reflux. Peptic ulcers, a lot of people have these, and what's interesting is it's caused by a bacteria. So the bacteria eats a lining, or it really basically eats a lining of the stomach and makes you have a lot of stomach pain. People can experience this just from stress, and so it is treatable with a combination of antibiotics and like omeprazole or something that is going to, I think 14-day dosage. But it is really good to understand that, and just taking, it's important to get antibiotics at some point if that's what it is. But as excessive amount of acid from the stomach, large amounts of aspirin or NSAIDs, people who are in chronic pain, smoking, alcohol, but yes, it liquefies the barrier to the mucosal lining. Very painful. Water even hurts to drink. So it's good to know, and it can Prilosec, Zantac, Tums. I don't know how much that's going to help, but antibiotic therapy to eliminate it is. You may treat the symptoms, but you won't get rid of the cause. If it is that, you need antibiotics to get rid of the cause. Okay, inflammatory bowel disease. There's different kinds. Crohn's disease, ulcerative colitis. It's basically, the difference is the locations. There you can kind of see how it highlights. It had Crohn's disease is discontinuous, but it's also, it can be from the mouth all the way down through the large intestine. Ulcerative colitis is more, it works backwards from the rectum up through the large intestine. So that's a main difference, but it affects people's lives and what they can eat. It's pretty serious. Okay, so under modules, you will find 3 pages of health histories, all the same patient. Get together with your teams. One person turns it in. So you just want to type the questions, and you could go slide by slide. And it's just a screenshot of a patient, just like you did before. Think of the questions you want to do, and then answer whether they can have, do they need a med consult? Do they need antibiotic pre-med? And I don't mind helping you while you're in here, so that's a good idea too. So questions, and you'll see the response form. Fill out the response form. That's the only thing that's uploaded to me. Go to modules for today. I know you're tired. Hopefully this will help you wake up. It'll be more effective than me talking to you anymore.
We do all 3?
All 3 are one patient, 3 screenshots, because I can't get the whole health history in one picture. So it's not nearly as bad as it looks. It's one patient, but there are quite a few things that are unanswered. They have yes, and they have some information, but you need to ask a few more questions. Just go slide by slide. Have somebody be your scribe in your team. One person submitted to me, but you want to be also thorough with your modifications to treatment.
The questions that you said are, you say they're in week 7 under module, but I don't, does anybody else have them?
It's student response form.
Yeah, it's not working out.
It's not. Me?
Under modules?
Under today's module?
Mm-hmm.
Really?
It's the PowerPoint.
Cancer, PGCs, or health history. Yeah, cancer, PGCs, or health history.
Yeah, but those are just the screenshots. We don't have the worksheet.
Right here. Oh, here.
Case
Let me
study 2?
let me plug it in. Case study 2.
Push that.
That's where you submit it.
Yeah, we clicked that, but there's nothing.
Oh, there isn't it attached?
No, it says no.
Okay. Okay. I will fix that for you right this very minute.
Yeah, but where are the questions?
Miss Hayden, the respiratory one, it doesn't tell us what kind of disease he has though. Yeah.
I'll be right back.
He has respiratory disease. Oh no. Hold on, maybe I did it wrong. I looked at
Did you go across and it's not there now?
Oh, it's a no.
But if they say yes and it doesn't tell you what kind, what would you ask?
If they don't tell us what kind?
If it's not on there, what are you going to ask them?
What are your symptoms?
I'd say, what kind of respiratory disease do you have?
Okay, so they would know.
They would know, yes. And there's, in that response form, there's some answers to some of that, so that will help you. But let me get that.
I must have like looked at it wrong. Also for the one with prenatal vitamins, there's no adverse reactions.
So no problem with that medication.
Are we doing it on a book opening? Because I have multiple questions. Oh yeah. I already did
Yeah, do you want to do it? I mean,
Okay, it should be there. Let me make sure it shows up.
Okay.
What's that? Okay, it should be there now, you guys. And that also, you want to pull it up now because it has some of the answers to the case.
no, it's at LA, but you can do Trisha Bodo at Gmail.
Right now I'm by myself.
Where's my group? Well, I don't think it will go to the LOU one.
Trish.
TRISBOTO@gmail.
And then do I yeah, that's everything. Here. You want to say M-I-L-L-I?
What?
Yeah.
They were just looking at me like, what's wrong? I know it's my hair.
And
Oh, they're just going, wow, it's so awesome.
Not to you.
I'm not learning now. Yeah, I actually.
No, I said it like
That
I
looked
shared
like
it with
a
everybody on Google Docs.
because I twisted. Because like
I had
I've had them before, and I went to a neurologist here, and he said I was okay.
We're doing a
Like they did it and everything.
I just did the ones
Is it going to sit down that board side?
Sometimes
No, there was.
I'll get one. Sometimes I'll get on this side, and sometimes I'll get on this side.
No,
And it you just stretch it,
It almost pulls me.
I've seen him do it. So what are the questions?
Yeah, no, that's what I thought.
I went and I saw. I like I said, I went and I saw a neurologist here. At the,
Did they do it? But they did an MRI. That's pretty.
So you did
They have to change.
Well, I did a question associate.
I know.
Thought about it.
I looked at the but I haven't done the modifications for treatment, right?
Are you still
The modification, like the treatment, what is it called? Treatment plan
There'll be like a
modification.
week or
Right?
Any other modifications? So you pretty much did all of them?
Yeah.
I can't.
the first one? The
I have
first
two
one.
right now. And then like, I can go home.
She's trying to go home to sleep.
I did things with sadly.
And like I went and I told her, I got
The seizure one I haven't done yet.
embarrassed at first.
Too, I did.
No.
Dementia?
Yeah, I mean, you see me get up and stop moving. I stopped moving. I don't know.
No tonight.
Oh, wait.
Oh,
Oh, right.
oh,
So how about we...
I always figured it was like a soul pregnancy just because.
Guys, the wrong thing? I didn't do that.
Yeah.
I looked at the
accident thing.
So
Rachel, do you want to sit here?
Yeah. And see, these hurt. Like it's not like. I'm just being. I'm also cramped.
Are you guys looking at the Millie?
I didn't look at that.
No, don't worry. No. No, I wasn't. I had.
The case study we're doing this?
I felt it coming, so I said.
So what are the 3 screenshots?
I never had one like.
Does the information match up?
It's only.
Maybe it's the same guys.
I have to like. That's why.
Yeah, I think it's all together.
Because I'm looking at the...
I'll go get checked out. I'll probably pick it.
Sorry about it. Okay. Maybe I overlooked.
Start drinking.
Wait, when you guys at? Up 11. Yeah.
we're almost done.
Yeah, it's not.
Oh, that sheet. Oh, I don't have that. All do you?
I know. No.
Maybe I didn't do this. I didn't look at that. I didn't look at this. I looked at the
Question, is this the Millie Molar?
Yeah. Yeah. Yeah.
So it's the same person?
Yes. It's just because I have to do millimolar for everything. She's only 32. She's not 54 or whatever. Because I axiom training, it's just how you do it. So
But this is her health
yes,
history.
yes, all the same. So those are the answers that you get
Where we
when
at?
you.
What do I need to do?
She has basal cell carcinoma.
Yeah, we have to do all 3.
So, and it should be kind of in order, so like, after questioning process, this should help you with your questions right at the beginning.
I don't know. I think it's good, but I don't want to say.
I'm pulling up epilepsy. Yeah, I see it right here. It says need for mid-consult.
What? So what are we doing? What's going on?
Guys, I did the wrong thing.
No, that's her health history.
If you look at page 1 of the health history, look at page 1 and go, what questions are we going to ask this patient?
Okay.
And then whoever you're scribing, start typing it. You could do it right after the paragraph, right before that paragraph. Who's the scribe? Tricia?
Yeah.
Okay, so start with, you guys all look at the health history.
I feel like we should just go one by one.
Or we can just do it on the Google Doc so we can all.
Done.
She already did the health. So one by one, and we'll do which one. Okay, so you asked why.
Let me just paste this document to the Google Doc so we can all look at it.
Yeah, that's what I'm saying.
Oh, we're going back on the Google Doc.
And it does it to me.
Yeah.
I still send it.
Alright, so you
Okay, well, let me work on it.
Alright, so type it right there. No, I'm just saying like. It's fine.
I'll check the seizure one. I didn't have a seizure.
Alright, that's all.
I guess we picked a good time. I guess I picked a good time.
You know
I don't know.
right, so start. So yes.
Like, are you okay, yeah?
I don't think she needs a med consult. I think she needs
Have you ever had an order
Well, I don't know. I think.
So we're discussing as a group.
Wait, when was the last time she saw the doctor?
Last physical was December 2019.
Yeah.
So that requires.
Oh, no, I'm not saying.
Yeah.
Is she physical? Are you worried about anything that you need a doctor?
So that's in the future.
Have you had any radiation therapy, chemo, for stroke, tumor? Yes. So what kind of radiation?
That's really good.
Maybe she meant.
Sorry.
2018.
Yeah, just her current.
That's what we want to do.
So she needs to go to the doctor, right?
Yeah, Nika says
Yeah.
she sees the shade.
What's that?
I'm looking at it right
OB/GYN for pregnancy. But do you need, you don't need med consult for the seizures? No? The seizures? Because she's not, alright, okay. Because of medication, she was taking medication. It was 10 years ago.
Well, okay, so the first question would be like, what was the reason you saw a physician? Because she answered yes to, she saw a physician for the last 5 years. But it doesn't say why. And it has 2 to 5 years ago. So it wouldn't be her pregnancy.
It was because of the carcinoma.
You know what? We talk about that. I'm going to have everybody pause for a minute. Just on the nitrous question, I'm just going to give you the answer because we didn't really talk about it. You are allowed in the middle trimester to give a little bit for like 20 minutes. But I would never do that myself unless they were having a heart attack and I was trying to calm down their pain level while we're waiting for. So I would say in the textbook that says that, but overall response is no. Don't give a pregnant woman nitrous. We're not going to take any chances. So just put no, she's pregnant. Okay, and that would be probably the only case I would use it is if the stress, the risk was worth or the benefit was greater than the risk. And that would be maybe in the middle trimester for a little while you're waiting for the EMS, but otherwise I would not use it.
Like we know that it's
But
Yeah,
we
we
still
still
have to
have
ask.
specific, right?
Well, we should still ask because it doesn't say.
Okay, then that's exactly, yes.
So if I ask you right now,
50% oxygen.
So you guys think she needs a med consult?
A short period of time.
I don't think so.
But I would try everything.
Hey, Lucille, can you help me editing and saying
What vitamin?
Oh, yeah, how do I do that?
No, she says.
I can't think
So
right now.
that
maybe they have like something so I don't like Continentals, which is why.
And the stress.
I saw Miriam on there.
That's true.
Mine is only
Here's the anonymous coyote.
Probably Laura.
Lucille.
Yeah, probably.
And all these guys. Megan, why are you
I think I have to go home. Can I click that?
I'm the coyote. I'm agent. I'm not. How did it be me?
No, it's you.
No. Yeah, Laura's the coyote. Earlier it was a kitty cat.
Did you ask what I was doing?
Yeah, I got the question.
Oh. Then I'll go my Gmail. Because it says it's owned by everybody.
Yeah, taking one for another. I told you that. John SDA, but like the letters.
I have no idea.
It's like, it's weird, 'cause I think it's important. Everybody's canceling each other out. We can't do it. Okay, so are the, oh wow, you guys are doing good. Huh?
I'm doing the seizure ones. Questions of putting them in.
Oh, you think I should do them?
I'm currently. Well, the first question was supposed to be, why are you under the care of a physician, right?
I'll look at health history, page 3.
We don't know if it's. I'm doing good. Because it says cancer. So is it cancer benign or successful? Are you still receiving?
She's not taking any medication.
Do you have any results?
Okay, when they were coming down,
And she's like, what's going
and then blood pressure, they said,
So who's doing what? I feel like we're on our
on?
Organize this, girl. Organize this.
I'm just kind of going in on it.
What are you working on? Mariam, what are you working on?
I don't know. Are you
Pick something. Yeah, pick something. Megan, what are you working on?
That's good.
Adrian, where are you at?
I'm just observing. I'm trying to think of what to do. I guess I could do the ASA classification.
Okay.
1, 20, 80,
I'm going to go to page 2.
Are you still under the care of
Why are you taking now she has seizures and epilepsy. No, now we have to well, don't ask that. We'll get more.
Alrighty.
Oh yeah. Did you leave it like that? Be like, yeah. How long did they last?
What's up?
What happened to them when they're lost?
What time was
Can you guys put your answers in bold or something so that I can use? We should make all of them red. Okay.
How long did they last?
You'd be like, going up.
Do you know why there's the ASA at the bottom too? There was 2 ASA. Oh no, I had put that first before when I had clapped in this class. Okay, so take this one out.
Wait, I just texted it. Oh.
She said, you're joking.
Alright.
It's elevated.
So ASA is classification.
I guess I can do that. Trish can do it. I would put her at a 2.
But doesn't she have gestation and diabetes?
Yeah, but that's temporary.
Is it
That
controlled?
gestational diabetes is usually controlled.
Is it?
Yes. It's like literally like the last couple weeks of pregnancy.
It's under moderate control.
Yeah. So severe systemic disease.
You're in the game right now, Christian. I'm really proud of you. I just like sit back and watch you.
And uncontrolled severe. So I would go with 2, mild to moderate.
Which ones do you have for epilepsy?
Including epilepsy.
The epilepsy is like an isolated thing.
So 2?
So I would go with 2, yeah.
What was your last name?
Are you in contact? Do you
You guys would say no antibiotic, no antibiotics needed.
Does she have an infection?
Well, she has a lot of dental caries.
Nah. If they were gonna do an extraction, maybe, but I don't see the need.
What else is that?
We could put antibiotics dependent on infection because they don't know if she has an infection.
Well, I just helped her.
So where?
Yeah, let me help you. Okay, so what specifically? Do you know what specific vitamins you're taking?
Just hand. Okay, now we're going to put antibiotics dependent on Dr. Diagnosis because we don't know if she has an infection.
Let's assume she does not, since it wasn't listed in the.
Well, because I said that she wants us to look at the.
Oh, yeah.
The gum.
So who would you? Let's say she's here at the dental. What I'm trying to get on that one is
just what we would do
here in the dental clinic. Who would you call? Does she need a mid consult otherwise? I just call oral pals to look at it. That's kind of what I was looking for.
Okay, gotcha.
She said she did say
So no med consult necessary, but we'll put needs tablets. Okay.
And no antibiotic pre-med?
No. We're assuming she doesn't have an infection.
What did she say about
It's okay. Epinephrine. Epinephrine.
And 4 years ago, she had 4 years ago.
Is this a word, no known infection? Because of no known infection. Is that the thing?
That's okay. We don't have to put that. Where are you writing that?
Right here. No antibiotic because of, how is it, no known?
Yes. I know what you're saying. Makes sense.
Fluoride? Xylitol?
That's nice.
So, last time she was your doctor or separate?
Yeah, I put no med consult necessary or need oral tab.
So number 3, we just delete it. And then
Oh no, I'll put it there. I didn't see that.
Let me look over this. Really? Oh, good.
What do you guys think?
I say
I want to stop everybody. I had this on the test last time. The blood pressure was, I believe it was 125/80, and I got 2 answers. I ended up accepting both, but I don't want this to happen again because you need to know. So if it was 125/80, is that in the normal range?
Yes. No. It's not.
Or it's called elevated. It's above 120. If either number is above 120 or 80, it's in the elevated What, or no, only systolic. Okay, so I gave you a tricky one on this one. What is stage 1 hypertension now? Do you remember? Anything over
130 over
90
and less.
130 over 80.
130 over 80 and above. Okay, so we stage them on either or, whatever's highest. So if it's 125 over 85, what does that make this patient? It's tricky. Stage 1. Not crazy. Because 85 is above 80. 80 is like the cutoff for normal or stage 1. Elevated, there's no room for elevated on the diastolic, only the systolic. That's tricky. That's why I gave you either on the other one. Does that make sense to everybody? Write it down and then you can figure it out if you need a distraction. So this one is stage 1 hypertension.
Now, Mrs.
Even though it looks pretty darn good.
Would it be necessary to stage
Why? Not here. It's gonna watch her.
It's bad if you give a fluoride varnish.
She's not high enough. But if it all
I don't think so. No, because they want you to do fluoride, remember, because they want it to get into the baby's system while it's growing.
Let's put some fluoride in there.
From their I
feel like we could give that.
I do not.
Maybe the tray that she has on her
Is it increased use of Perry's varnish? No?
The varnish would go more systemically, wouldn't it?
Yeah.
And then it sits in the oral cavity, so you end up swallowing it. Whereas, yeah, I think.
You could ask her.
I was thinking that's 15. Yeah.
So because she had diabetes,
I'll go right after.
would we check her vitals at the end or something? Something like that.
Well, it depends on how they are.
Well, you know, she said she's fine. She doesn't experience like
Okay, 128.
So it's like, okay, so.
Sorry, basal cell carcinoma was in her mouth. Head and neck radiation.
So for treatment,
She had radiation and excision. She had excision and then radiation to her head and neck. It was in her mouth.
yeah. So we're gonna do fluoride treatment.
No, she had it 4 years ago.
Oh, there was some
Been treated,
saliva.
but it was in her mouth. If you had any question on that.
Because her salivary gland.
Okay.
Yeah.
Yeah, we wouldn't do varnish.
Or
Yeah, varnish.
Like
I didn't think that would get
regular.
Or
You can do fluoride rinses, varnishes. It's gonna be a regular.
Daily.
Oh, daily.
Yeah.
Put that on there.
I don't know where you are, but I would write it.
Okay.
Oh, there, I see it.
Artificial saliva supplements.
We'll put for the rest of her life. It's for the rest of her life. Fluoride daily for the rest of her life.
For lifetime?
Lifetime. Yes. What else, guys? I think this is our last bit. Is this thing?
Which one?
The modifications.
And I think she's gonna grade in order now.
She told us that she gave us some really good comments on our last one. She said we were very specific.
What did we? I'll read those right now. See what.
Very thorough. She said we were very thorough.
Okay,
There's one thing we could add.
I know you're just finishing up, we'll just make sure Dr. Leggett has a meeting at noon. Meet your ortho teacher this summer. This is Dr. Linda. This is your junior class of 2020. So you're going to learn all kinds of
Me too.
I like your tie.
So you can they take 5 minutes as long as they're out of here?
Artificial what?
12 o'clock.
I like them.
Yeah.
Any other questions? Does this patient need a med consult? Let's talk about it. No?
Saliva.
Maybe what kind of consult? Maybe since you're at the school. Let's say you're at the school. Pass. I probably have passed since I'm here. Okay. For the pyogenic granule.
Oh, we have that.
After
Supplement. What do we call that?
I've only heard it as artificial saliva.
Because there's several different kinds.
It's kind of it's a solution.
Okay.
I think I'd use solution.
Gel.
It's yeah, you put it in your mouth and try to spread it out.
I thought you were going to
I know.
I'm so sorry for
we got the it says she has the gestational diabetes, but it says moderate control.
Did you ever text her back?
but she's not on medications for it, and her doctor feels like it's safe for her to be diet and exercise.
And then the cancer isn't like
I agree with you. I would choose to. And she's on no medications, and blood pressure's above, and automatically too, and because of her gestational diabetes.
Anything else, guys?
she said 2 is good. We're good.
Maybe, when do we have to come in? Now?
Today, what's today?
It's due by 11:55.
Today?
Yeah.
Okay, let's finish it.
I think it's due right now.
Yeah.
At 11:55.
Do you want me to submit it?
Submit it, please.
Are you making any changes?
No. I was trying to highlight it.
I did like the
Can we put our name on it? Names?
put my name on there.
You just put group 6,
Yeah, so
right?
you could just put group 6.
Group 6.
I'm just gonna put your guys' first names, okay?
Okay.
I'll see you over there. I'm gonna be on my way. That's it, right?
Yep. Sorry, guys.
I feel like everyone has actually. Yeah. Like it looks cute. I feel like it like highlights my fun chest. Yeah, I was like, I don't like that. No, I don't want to. I feel like it's, yeah, it's longer.
Did they ditch you?
Oh, I did it. It's late.
Oh, she's not gonna penalize you. Or else I'll punch her. We've been going on.